Greetings. I want to quickly tell you the functions of the amniotic fluid. The amniotic fluid is the water with which the baby swim in during labor, during pregnancy, right? And it has its functions. One of the functions is that it is protective. It has as a shock absorber, right? It's like the way the brain is in the cerebrospinal fluid, it has as a shock absorber for the baby. So in the event of accident, the baby is more or less protected. Number two, it provides nutrient for the baby, right? Provide nutrients. Then number three, it aids in labor. It helps in labor. That water, it acts as a lubricant for the baby to pass through. Number four, right? That is number four now. It is the inside that amniotic fluid that the baby urinates in and swallow, right? Number five, it is the medium with which the baby can move, right? Without getting injured, right? Imagine the baby's body is touching the what's I would like call it now. The baby's body is touching the womb, the baby will get injured. That's why some babies in the case of oligohydramnios, when the amniotic fluid is too small, the baby gets injured. They start having some injuries inside the womb. So the amniotic fluid now provides nutrients, it's a shock absorber, prevents the baby from getting injured, lubricates the baby and the birth canal during labor. Another thing it does is that amniotic fluid has a way of making sure that the baby develops very well. The baby develops very well. For example, if the amniotic fluid is small, it shows that the baby's kidney is having some problem because the baby is not urinating well. It's a pointer that the baby will have kidney issues later or genitourinary problem uh, later. Then if the amniotic fluid is too much, it also shows that the baby is not swallowing. So the baby is going to have some form of gastrointestinal problems. You get what I mean? So the amniotic fluid is a pointer to whether the baby is doing well in the womb. You understand? It's a pointer to whether the baby is doing well, whether there is some congenital anomaly. Do you know the amniotic fluid can also be used to diagnose diseases of baby in the womb? If you heard of amniocentesis, where they would go to the theater, they will take some fluid from the woman's amniotic fluid, right? They will take some fluid from the woman's womb for analysis. They use it to analyze whether the baby has some diseases, like especially Down syndrome, sickle cell anemia, and the rest. You, you get. So amniotic fluid has its function, as you are seeing it there, like acting like a bag of water. It's very protective to the baby, right? So that's why when you go and do a scan, when you do a scan, they always comment on whether the amniotic fluid is adequate or not adequate. I'm going to comment on that after this video. The adequacy of amniotic fluid, the actual volume how it's supposed to be. You get. Itemize a lot of issues with benefits of the amniotic fluid to the baby and even to the woman. I've analyzed a lot of it. I've told you about them. Uh-huh. Thank you and bye bye.